My name is Leo Igashira.
My name is Jamie Land.
My name is Stephen Nez.
My name is Case Craig.
I'm Marina.
My name is Jessica Kipp.
My name is Meg Menigal MacDonald.
I am Angela Gaffney. I go by Angie.
I'm Jacob Fonkersitsky.
My name is Craig D.
Tessa Evans Campbell.
My name is Myra Parker.
Yat e analto tiu banali inishie twitchini nishale sitnanjini bashichin zalane dashichedo ki ani dashanele yatahe de nashak Seattle, Washington de kajt e akut out de nestan nishle. So hi everyone, I greeted not only you but everyone. My name is T Banali.
I'm Mandan Antadatsa. I'm an enrolled member of the 3 affiliated tribes, which is located in North Dakota. I was asked to apply to be on the advisory board for the exploration process of, do we need a public health institute specifically focused on tribal public health issues? And our colleague, Alina Kawe, at the time was working out of Arizona and had kind of headed up this process with a lot of input from some of the mentors that we both shared in Arizona. And so she was able to secure some funding from the CDC and Robert Wood Johnson Foundation and the Kellogg Foundation to have a series of national convenings to explore, what this might look like. And is there a need for a tribal public health institute? And then it culminated in this meeting in Gila River in Arizona with about 125 or so tribal public health experts and practitioners. And through those conversations that Alina and her team led, we were able to actually identify these 7 directions that kind of form the basis for how we do our work. That was sort of the key point to kind of move it forward and to establish 7 directions.
There's a variety of things that make 7 directions what it is. I think one of the big ones is just the team that we have, the experience, and then also diverse backgrounds that we all bring together. In regards to the vision, is starting with our leadership. Myra had this goal of what she wanted ONOJ to reflect. She wanted to know from 7 directions, our Indigenous knowledge, but also that content expertise. Most organizations or Western organizations have this hierarchical approach, but really open up the floor that this is a collaborative approach and that we're a team and we're able to accomplish that together.
I think what 7 Directions is doing is we're at the forefront of making sure that Native knowledge, Native traditions, strength-based approaches are there to be utilized to improve the health of Native American communities. I view this work from both a social justice lens because of my own personal history and a racial equity lens.
One of the projects that I've been working on is taking the CDC's opioid prescribing guidelines and integrating a tribal perspective. So what do providers who are prescribing opioids to Native patients need to know about the way Native folks approach both medicine and pain relief and care generally, and also what are the limitations of our current medical system that providers would need to know.
7 Directions, I think, just puts a lot of intentionality behind what they do. Dr. Myra Parker, she's, for me, has been a great mentor. They're not only doing the work, but they're also preparing future leaders to take on that work too. And the new researchers coming out of UW and just wanting to help provide that mentorship.
Growing up, Navajo Reservation, there was not a lot of awareness of organizations that were already doing this type of work. I thought it was something that wasn't happening, but 7 Directions is already doing that type of work. I'm working with the Indigenous Social Determinants of Health project, and I'm working with, my capstone is to create an infographic or something that educates youth on how they conceptualize health and well-being through the connection to water. And I think in a lot of westernized science, water's not a metric that can be connected to health and well-being. So being able to have that leeway and to be able to measure that through qualitative data collection is pretty awesome. That's what 7 Directions really provides for me to do in comparison to all these other organizations that are not doing what I get to do with Seven Directions to work with Indigenous communities, which is awesome.
Yeah, I am a research coordinator, so I work on a few different projects. The main one is probably our Indigenous evaluation work. One of the things that I like most about it is being able to work in community. We have an Indigenous evaluation toolkit that helps programs kind of evaluate their successes and kind of where they're going, but through an Indigenous lens.
Seven Directions is really leading the way in how we are using resilience in the way we do public health. Seven Directions is such an amazing organization that they really put community first. I think this is one of the first organizations, and its leadership as well as its staff is really engaged in community-based participatory research.
I think that they're some of the most passionate scholars that I know, and that they are so deeply committed to working with and for Indigenous communities and really listening hard to what people want for their communities and a focus on strengths.
From like an infrastructure perspective, I would hope that there is a greater understanding that tribes know what to do for their communities and that funding streams are aligned that way so that there's just a lot of unrestricted funding for tribes to do what is best for their communities and evaluate it the way that they would like.
I think that want to be able to see tribes being able to make decisions about their healthcare, being able to get the resources that they need.
It's very important to have people who know the community and the culture be the ones who are leading the effort to improve health and wellness.
I think that Seven Directions should be, kind of the name or one of the names that people think of when they think of Indigenous public health.